Now, this panel discussion coming up next is on strike, the stroke with a balanced lifestyle, and will shed light on the causes and the care for heart ailments. I would now like to invite on stage our esteemed panel, Padma Shri Dr. Mohsin Wali, and he's the Senior Consultant Department for Internal Medicine at Sir Gangaram Hospital. He has previously served as full-time physician for the former Presidents of India, Mr. R. Venkateshwaram and Mr. Shankar Dayal Sharma and Mr. Pranab Mukherjee. Dr. Wali is the only clinician in India formally trained in geriatrics. He has been the recipient of the prestigious Rajiv Gandhi Excellence Award for Medicine. Dr. Wali, please. May I also invite on stage Dr. J.P.S. Sahani. He is the Senior Consultant Cardiologist and Chairman for Cardiology at Sir Gangaram Hospital. With a remarkable experience of 39 years in the field, he has been the former Senior Consultant Endocrinologist at King Khalid Hospital, Saudi Arabia, which is the Ministry of Health. Joining them on stage today, I would like to welcome Mr. Abhishek Kapoor, Senior Executive Editor, Republic Media Network.
Thank you so much. My very esteemed and accomplished guests have been introduced. So let's hit the ground running. Dr. Saab, when you must have been young, very young, there was this Bollywood number, Dil cheez kya hai, aap meri jaan le lijiye. Maybe in your age now you would say, cheez mat khaiye, jaan bacha lijiye. So basically we're discussing heart health and the public health part of cardiology. That's what people are interested in knowing. The moderator just said that we have seen increasing number of heart attacks getting reported, people falling down like while playing, while walking, and we live in social media times, so many of these moments get captured on mobile phones and they go viral. If I could begin with Dr. Wali, are you seeing a trend where earlier we thought that heart attack was something which happened in a certain age, when you have a coronary artery condition, or when you have, blood pressure, sugar, thyroid, and then these comorbidities lead to a heart condition and possibly heart situation, heart event. But now increasingly we are seeing even youngsters falling prey to that. Recently we had one doctor in Jamnagar, a cardiologist, a famous one, just 41 years old, and he suffered a massive cardiac arrest in sleep and passed away. Dr. Wali, just give us a lowdown on what's really happening.
Thank you, Abhishek ji, and thank you, Republic TV and Republic Dialogue for bringing us here. Yes, heart is an organ in the body which does not take leave. Just now, some of you asked a question. Let me give the answer first, and then I'll answer the question. What do we recommend for corporate world, for the employees? Don't give them stress. That is the answer. So heart is always under stress of its duty to pump the blood from the heart till the root of the hair and the tip of the great toe without fail. All the time when we are awake, sleeping, talking, walking, swimming. So this organ from the fetus of 4 months old beyond till the last breath of life keeps working. You very rightly pointed out that incidences of heart related deaths, one part of which is very, very important, has become especially more important after COVID, sudden cardiac deaths happening at unusual age, which has been happening in India. If we sum up the statistics, and we have recently concentrated on that part of the statistics, we do develop heart attacks in Indian population 10 years younger to the world population, and especially in the young and males, we have seen very large number of unprecedented deaths during COVID, post-COVID, and we keep seeing them. The cardiologist, you gave the example of Dr. Gaurav Gandhi, was only 41 years old, and he lost his life while sleeping unnoticed. In one hotel I was staying a few years back with one VIP, one of the hotel owners, very famous hotel owners, died during sleep. Same way that we did not point it out. We lost colleagues like your colleagues like Siddharth Shukla, singer KK, and many more people, Mr. Amit Mistry, Rohit Sardana, Nitesh Pandey ji, and many more like Raju Srivastav ji, Om Puri ji, Rima Lagu, and Satish Kaushik ji. We saw all those very broadly on TV screens. But to me, to my surprise, more than this, our beloved doctor's case was the young couple from Bahraich. They were villagers, youngsters, no stress, living in a normal serene atmosphere of the village. Both collapsed on their honeymoon night, found dead in the morning, postmortem proved cardiac death. This was to me very shocking. We talk of stress, we talk of lifestyle, we talk of high cholesterol, we talk of sugar, diabetes, overweight, broad waist, everything, hypertension. But what happened to this young couple who was in village setup? So something is changing, and we have to be, people like us should be dedicated towards the care of the heart disease in young, strike them young, and that is the answer to the problem for tomorrow. And India is doing a good job in that direction, and we will talk further on this. Thank you.
If you, picking up from where Dr. Wali left, surprising that these youngsters are getting this. I quoted the example of the Jamnagar doctor. He quoted the example of this young couple. What are the numbers like? Are we seeing more heart conditions getting, heart attacks getting reported, or are we seeing actual increase or a spike in heart attacks? If yes, has the condition worsened now, say, from 5 years back and 10 years back, or is it better because of the better healthcare that we have? If you can just give some idea.
Thank you, Dr. Abhishek ji, and the thanks for Republic. And let me put the first question in further perspective, that yes, we get heart attack 10 years earlier compared to the rest of the world. On average, what we have statistics, what we have done research on that, we found that more than 50% of the population in our country, they get heart attack less than 50 years of age, which is 3 times more than the Western world. It is only 15% there, but we get 50, and around 20% of them are getting heart attack below 40 years of age.
Can you just hold a little closer? Little closer.
20% of the people are getting below 40 years of age, which is alarming. When I take the round in my CCU, I found young people getting heart attack between 30s and 40s these days. So we started looking into the data, why this is happening in our country. Why are we getting heart attack earlier? So we analyzed that the most important factor is, the commonest factor of heart attack is the risk factors. And the risk factors is diabetes, blood pressure, high cholesterol, and smoking. And stress, of course, fifth factor. But these are the 4 identifiable risk factors. What we found that in our country, the central obesity is very common. That would call is metabolic syndrome, and we attain those risk factors of hypertension, blood pressure, and high cholesterol in younger age. This is what we found, one of the important factors, with central obesity coming up. Second important factor what we found was that although smoking government has taken steps to ban the smoking and all that, but BDs and the chewing tobacco is still rampant in our country. There is no action on that area. And we know that if you take tobacco, 3 times heart attack, 4 times lung disease, and 5 times cancers. So that is another area which remain untouched. And most important fact, where we did the study in Gangaram Hospital, is that the genetic risk factors for heart attack, what we say familial hypercholesterolemia, where there is increased production of cholesterol, which causes blockage of the artery. We must learn one thing: if the arteries are getting blocked of the brain, heart, or legs, It is nothing but the LDL cholesterol which enters and causes the blockage. Who pushes it? High blood pressure, diabetes, stress, smoking. They push the LDL cholesterol inside the artery. So, but the common denominator is cholesterol, LDL. So most important risk factor, LDL, remain unidentified in majority of the patient. I had an opportunity to treat some of these celebrities recently, and then many of them, I will not name them, but cricketers and some of the singers, they came to us in Gangaram Hospital, young people. Only area which they used to say, I am very fit. मेरा BP बिल्कुल normal है, मेरा sugar normal है. Then why did you got heart attack? Why you got stroke? I asked him, what is your cholesterol level? No knowledge. Absolutely. When we examined them, then we found there was a family history of heart disease. So premature history of heart disease in the family is the most important factor which remains neglected. Because of blood pressure and diabetes has got some symptom, cholesterol has no symptom. Yes. Unless and until you do the test, you will not be able to know the number. We know that it has to be kept below 100. So unidentification of this risk factor is also a very important thing which is prevailing in our society. So what we found, familial hypercholesterolemia, premature coronary artery disease in the family, and now we found another factor called lipoprotein little a, another genetic factor. This is also an important cause of premature heart attack. So these are the factors which we identify that they are the cause of getting heart attacks 10 years earlier, which leads to a burden to the family, to society, to the country. Because these are the people, those who are working, they are not retired. As against the rest of the world, people, most of them, they get heart attack. They're retired population. So that makes a difference between the two.
Right. Actually, that helps me take the conversation forward with you, Dr. Wali. Dr. Shawni says that many times they have realized when people come, there is a certain lack of awareness. They're smart people otherwise, achievers, going to the gym as well, but then they don't know perhaps if there is a family history. Family history is one aspect. Lifestyle is another aspect, as you mentioned. I sort of pushed in chole bhature khane chahiye ki nahi, kitne khane chahiye. But apart from that, are there any markers by which we can really track ourselves, say, after the age of 40, or should we be doing it, and if yes, how often? Sort of angiography, for example. What are the markers available by which we can test ourselves every year and find out whether we have a risk of a cardiac event in some time?
Yes, the heart is a very, very intelligent organ, and it gives us indications, what you mean by markers, and the young generation is getting gradually aware of those indications. I would say we should wake up the people for noticing these symptoms, which are often ignored. Sudden cardiac death is not so sudden, but it keeps giving signals. Today a signal came from outside that there was a bomb scare outside this hotel, and immediately my heart rate went up. So that's the first signal. If we have a stress, if we have a predestined risk to the heart, the first thing we have is increase in the heart rate without any cause. Second is discomfort. When you are sitting, all of you are comfortable. Sometimes you have a feeling which a common man describes gas. It's always not the gas. It's a symptom related to the cardiac blood flow. So we may call it some symptom like angina later on when it is fully blown up, or it could be just a chest discomfort. You get breathless when you climb the stairs. If you are living in the same house 5 years back, a boy who was in class 12 was climbing and running after coming to the school, throws the bag, and now he is in the college after 2 years or 3 years. He feels difficulty in climbing the same staircase which he has been climbing since childhood. That's another symptom, getting breathless without any definite cause. So all these indications come, and especially sometimes when we are very nearing to the sudden cardiac event, then these symptoms come after meals. So postprandial occurrence of a raised heart rate, or getting breathlessness, or headache, or waking up during sleep also could be one of the symptoms of an impending sudden cardiac death. So late night waking up, or in presence of the risk factors which our Dr. Shawnee was talking, in addition, makes it further relevant. And we have tests in these directions. The proper answer to your question is yes, we have many tests. A record of a heart rate, we should see any symptoms. A plain, simple ECG after the age of 20 is very good to have. We have actually raised the level of consciousness. Just now in the morning I was discussing with Dr. Shawnee that cholesterol guidelines he is going to revise for the whole nation. And that we are slipping gradually from 25 to 20 and now 18 years. That's the age we should be watchful for and beyond, 18 and beyond. And then there are simple modalities like blood tests which point out towards the raised low density lipoprotein cholesterol and so on. Then there are very useful tests if some has symptoms. Like we used to cycle in the childhood, we used to cycle it very bravely. Now if the same cycle I am using, I'll have some discomfort. Or abnormal beat. So this abnormal beat can be spotted. If not in ECG, then a simple test which records a long ECG for the whole day, which we call it Holter monitoring, which is now very less talked about but very useful test. And then we have a stress test, Pitbull test, and then comes, of course, angiography and so on, and then the whole story takes a different move. So yes, there are warning signs, there are warning symptoms, and heart always gives us warning before it ceases to work.
Thank you so much. Actually, I am almost coming to the end of the session. Dr. Clare also, again from his presentation, I was picking up these numbers. He said 18 million deaths due to cardiac events last year, of which, according to him, 70% were preventable.
Yes.
And that's something which is significant. The preventive cardiac care. Professor Wali said that in his last sentence.
I've got to add a little bit, last part of my, can I share with you? Dr. Clay's talk, and I want to just, that the last 2.5 decades of medical advancement has given human being a lifespan increase of 10 years. When we look into the data in detail, we did a research, we found out of those 10 years, which department has contributed maximum of medicine departments. I was pleased to inform you that cardiology contributed 7 of the 10 years. And when we look into the further details, out of those 7 years of contribution of cardiology, the 90% was, 50% was lifestyle modification, which we know that we have been discussing in that morning session about diet. But diet, one thing we must remember, the lipids, the cholesterol diet, only 20% is contributed by the diet which constitute the blood cholesterol. 80% is synthesized by the liver, which is genetically determined. And the diet which increases cholesterol is only one thing, animal products, milk, egg and meats. No other product will have cholesterol because there is a manufacturing unit of cholesterol in the animal kingdom, liver. There is no liver in plant kingdom. So anything which comes from the plant kingdom will have no cholesterol. So many times myths are there in the society. The milk, kaju nahi khaiye, isme cholesterol hota hai. Kaju has 0 cholesterol. Similarly, people say milk is very essential. Milk has significant cholesterol. So these are the myths of the society where you want to say exercise, tobacco cessation play. The most important thing is the drugs. The statins group of drugs which has lowered the cholesterol, beta blockers, what we say antiplatelet drugs, aspirin, they have played a significant role. Together 50 and 40%, they have managed to manage the risk factor effectively, blood pressure, cholesterol, diabetes mainly, and tobacco cessation with that. 10% has been only contributed by bypass surgery and stenting. So the intervention cardiology has played a role, but it is only 10%.
Right.
Just giving the same thing what you say. It is a preventive cardiology which makes the ultimate answer. If you control your risk factor, you identify your risk factor earlier and must ask everybody after the age of 18 years when they start going to the college, they should have their health checkup. Everyone checks blood pressure and sugar. Nobody checks lipids. That makes a difference. So 18 years is the time when one should get it done. If it is normal, every 5 years. So get the risk factor in order.
Right.
Then I think probably we'll able to prevent the cardiovascular disease.
Very nice. Fantastic big numbers actually, and perhaps we would need one full session on preventive cardiology. And this is very informative. I think whatever we have discussed, if you listen to it with some attention, every bit of it actually you can use in your life.